Hey everyone, Frank Garza here, and in our last video we talked about the most common rotator cuff muscle that is torn that causes shoulder pain, as well as how to test for it. In this video, like mentioned in the last video, I want to talk about the severity of the tears, or the grades as I call them, the grade of the tears, and whether or not it can heal or not, okay? So let's go ahead and dive into the grades of the tears. And like I have them here, like I mentioned before, we have three grades: grade 1, grade 2, and grade 3. So grade 1, in this tear, the muscle is actually just stretched or strained. There's no actually severe tearing of the fibers. They, I think, call them micro tears. But the good news with grade 1 is that it can naturally heal itself, you know, with just movement and some treatments for pain in about 9 to 14 days. Okay, so very treatable, very reversible condition, and usually has really good outcomes. Again, because the actual muscle itself did not sustain a tear through the fibers in the muscle. It just kind of pulled or stretched it, or what we call a strain. So the grade 2, now the grade 2 is a partial tear of the muscle. Okay, in these, people usually present with, really increased pain in their shoulder with movement, especially reaching overhead or maybe reaching behind your back. They also have pain at night sometimes. And, sleeping on their side really increases, or sleeping on the side of their shoulder pain really increases their pain and causes them to lose sleep at night. And again, it's very painful. So grade 3 then is a complete tear of the muscle. In this one, all the fibrous units of the muscle are torn completely. And in this one, people just complain mainly of having severe weakness in their arm and inability to lift their hand or shoulder overhead. And when they do lift their hand or shoulder overhead, they do it like this, because they're having to trick themselves to perform the motion that they want, because that muscle is completely torn and it's not able to do its action of lifting overhead. So if somebody has a grade 3, it's usually that person that typically doesn't have any pain, but they just can't lift their arm, and it looks very funky, okay? And that's because they're having to use other muscles that don't normally perform that motion to actually create that motion. Okay, so there's good news and bad news with this. So like mentioned before, grade 1 is very treatable, very well can heal and reverse itself on its own with minimum exercise and treatment. Grade 2 can definitely heal, okay? But the bad news is grade 3 is cannot heal. Because the tendon and muscle is completely torn, this grade of a tear requires surgery to be able to heal. So what I want to do though is, in our next video, is talk about the single most common mistake that people with shoulder pain do, that are usually grade 2s, that makes them regress into a grade 3. And we'll talk about that in the next video. So thanks again, and for registering for the workshop, and we'll see you soon.